The beta blockers are antihypertensives. They're low pressure, probably being one of the big ones. And these are, we call them cock killers. They are killers of erections. And doctors need to warn people about the sexual side effects of medications, and they never do. I bet you've never had a doctor warn you about the sexual side effect of medication. I've never had a doctor warn me about the sexual side effect of medication.
Welcome to Mind My Age, presented by Total Life, therapy focused on healthier aging and covered by Medicare. I'm your host, Neelam Brar, and today we're addressing an important topic, men's sexual health, and how it can positively impact aging. Our guest is Dr. Elliot Justin, a leader in men's health, MD, specialist in emergency medicine, and a medical technologist with a specialty in remote patient management devices. Dr. Justin, it's a pleasure to have you. You've done extensive research in men's sexual health. Can you explain how the sexual health ties into overall health? You mentioned cardiovascular disease, reducing cortisol levels. Like, what are some of the other top benefits of having a vibrant sexual activity?
There's probably not a body system that doesn't benefit from regular sexual activity, from one's mental health, the satisfaction in one's relationships, one's self-esteem, onto cardiovascular, and even skin and immune system, or decreased duration of flu. There are so many studies validating this, but yet we don't emphasize it. We doctors fail our patients about this. We doctors make recommendations about diet, exercise, sleep, alcohol, drugs, compliance with medications. We don't make any recommendations about sex, and we should. We don't even ask. And the patients don't ask either. So here you have this area that's of vital importance to people's happiness and overall health, and also reflects the side effects of medications, and we don't ask. For example, for men and women, doctors prescribe, there are two classes of medications that are commonly prescribed. More than half the country is taking one or both of them, and they are antihypertensives and antidepressants. And most of the antihypertensive medications and all the antidepressants have a negative impact on sexuality, both desire and ability to climax. That's a major problem. So it's as if we doctors think, oh, this area of life was unimportant because we don't ask about it. And patients get that same sense from the doctors. This is embarrassing. I'm not going to talk about it. He or she's not bringing it up, and I'm not going to respond. But with technology, one can actually assess the status of one's sexual health objectively. And then if one is taking medication, one can then titrate the dose. What dose is right for me? What dose is not good for me? So we need to recognize the importance of this.
Coming back to, there are a lot of medicines that create the problem or exacerbate it. So what are some of those medicines that people should be looking at that might be impacting their ED symptoms?
Almost all the SSRI antidepressants have an impact. And we have men using our technology to assess what's the right dose, because what the doctors do is we treat everyone as if they're one size fits all. If you and I, again, with different ages, different weights, different genders, if we went to our family doctor and said we're depressed, they're going to probably put us on the same dose of whatever, Wellbutrin or Lexapro, whatever, Cymbalta, whatever it is, and that's stupid because the medication should be ideally be related to some objective monitor. So we don't, with blood pressure, we check someone's blood pressure and we give the dose is based upon the blood pressure. But when it comes to depression, that's not the case. Now, when it comes to a lot of the antihypertensives, also have an impact on sexual function. I'll talk about myself. Probably because I'm involved in a startup, and I'm old. I started getting high blood pressure last October. My internist recommended I start lisinopril, common antihypertensive. And lisinopril made my erections 15% less hard. Why would I take that drug? I switched to losartan. and the problem went away. The beta blockers are antihypertensives. They're low pressure, probably being one of the big ones. And these are we call them cock killers. They are killers of erections. And doctors need to warn people about the sexual side effects of medications, and they never do. I bet you've never had a doctor warn you about the sexual side effect of medication. I've never had a doctor warn me about the sexual side effect of medication.
What are some of the most often objections that you're hearing from men regarding wearing a ring versus taking a pill?
There's a pride issue with men, and it's largely an issue for straight men. 90% of gay men use erection rings regularly, and only 10% of straight men do. And one of the jokes we have at medical meetings, like the American Urology Association, is how do you tell the difference between a gay doctor and a straight doctor with one question? Do you use a cock ring? Gay doctor, last night, you got a better one? Straight doctor, oh, it's like Superman kryptonite. Oh, I don't need that. I don't need that. Well, it's not about need. It's about want. Do you want to last longer and have more intense pleasure and more confidence, and have your partner also enjoy the benefits of your lasting longer and have more confidence? So the objections, I think, is really pride. It's the I don't need, as opposed to recognizing that I should want this. There's also really it's a very small number of men say it's uncomfortable. That's we've sold about 13,000, and maybe 20, 25 men say they're uncomfortable. So I think it's an issue. It's a psychological issue for men. Look how long it took vibrators to be mainstream for women. In the 70s, my mother's vibrator was in the bottom dresser drawer of a supply closet. That was the 50s. In the 70s and 80s, when I was dating and they were becoming popular, there was still this notion, oh, you, Neelam, you should need to come with penetrative sex, shouldn't need a vibrator. And now they're mainstream. I don't know how many wife owns. And my daughter, who's 29, takes them on dates. It's no longer seen as a crutch for women. It's seen as it's seen as normal. And any guy who's not too proud recognizes, hey, I don't care if my partner uses a vibrator. It's enhancing her pleasure. It's great. I think men need to see erection rings in the same context. And I think some of this will come from women. Women need to educate men. What we're really doing here at Femtech is not really a sex toy, because there's not data component, which is the ring, which will help sustain erection, and then there's a data. Women pay more attention to their health than men do. Men are deniers. We have women buying our device for their men to demonstrate to the man that you have a health problem. We've had 2 men get cardiac catheterizations that I'm aware of because their wives finally said, hey, let's figure out what the problem is.
I think there's so much that people can take away, but one thing I'm definitely taking away from this is sex is good for your health and your ability to age healthier.
Again, I'll just reiterate some of the data. You can cut your cortisol stress hormone level significantly by having regular sex. Your relationship will be stronger if you have sex. And there are studies showing that at least on the male side, I'm going to be trying the female side as well too, that if you have sex, you can actually decrease your cardiovascular risk significantly. So it's time for doctors to start recommending sex as well as other things.
Dr. Elliot Justin, thank you so much for sharing such invaluable insights on men's sexual health and how it plays a critical role in healthier aging. Your candidness about sharing your personal stories, as well as your open and honest approach towards sexual health, is refreshing. And I think we need more folks like you really discussing how important it is for people to be talking about sex and to be having sex. So for our listeners, if you're facing any of the challenges discussed today, please reach out to Total Life. Expert therapists are available to support you, and the services are covered by Medicare. Don't forget to hit subscribe for more episodes that dive into the science of healthier aging. And stay tuned for more wisdom and inspiration at Mind My Age.